Today's date's the 26th of June, 2016. We're here with Karen. Karen's a physician, and she came to see us for training today, and she's in horrible pain right now in her left SI, and you can just look at her face.
Ouch.
Ouch. You want to comment on it?
Sharp stabbing pain. I don't know. I'm going to make the plane ride home. It's really like somebody sticking a knife in my back.
And when did this start?
This morning when I got here.
Out of the blue?
Out of the blue.
Have you ever had this before?
Rarely this bad. Okay, on occasion, but rarely this bad.
But it's happened before.
Yeah.
What have you done for it?
Infrared wrap, massage.
Okay.
Advil.
And Advil. All right. I'd like to try something on you, especially your teeth, okay?
Okay.
All right. Hold.
That's much better.
Okay, real strong. Hold. And her face is cool. And look at her. It's hold.
Yeah.
And there's no strength here.
Yeah.
Okay?
Uh-huh.
So we're going to do, it was the bottom one?
Mm-hmm.
Are you injecting the inferior alveolar?
Actually, I'm injecting the gum. I'm injecting the buccal side.
I see. Let's see if I can get a better picture.
Okay, that's good enough. Now, keep. All right, Karen, we just got done your injection. Can you sit up, please?
I can feel better. Yeah, I feel better. I can't say it's completely better, but it's significantly better. But it's not
Significant.
better. Yeah.
That's only 20 seconds,
Yeah.
right? On a scale of 10, I mean, I'm going to ask you again in a couple minutes, but right now, 30 seconds later, on a scale of 10, how much better is it?
I'd say it's like a 6 or a 5, but it was a 10 before.
It was a 10 before.
Still-
Okay. Now, Sam, hold this, and I'm going to ask you to lay back down again.
Okay.
And let me have your legs straight up.
You want me to get
Yeah.
the legs?
Yeah, just back here, just the way you were doing. Is it running?
Now it is.
Hold. Nice and straight.
It's better. It is better.
Okay.
I wish it were all better.
All right,
It's
we're-
better.
I'm going to get the feet
Come on,
first.
come on out here. We're going to do the feet. We're going to do this here. Hold.
Uh-huh.
Nice and strong, right? And you got that.
Yeah.
And you can see her face. Now we're going to do this side.
Yeah.
Hold. And look at this. Hold. Look at her face.
Yeah.
Look. You see her face too?
Yeah.
And look what I'm doing. Get me too.
It's better.
Good.
And I want to video her directly. Karen, what do you say?
Thank you.
Sit up.
No.
What's happened?
My SI joint is significantly improved. The pain is going down. The pain is definitely going down.
Okay, we're about 3 minutes, 3.5 to 4 minutes out now. On a scale of 10, you gave me 5 to 6 before. From 10, what is it now?
3. I'd
It's
say
down
about
from
3.
10 to 3.
Yeah,
And you could survive like this, right?
I could. Yes.
Okay.
Can I get another shot?
Well, we'll talk about that in a moment. I'm going to put this on YouTube, okay?
Okay.
I want
Fine.
people to know. And Sam, you've been practicing this stuff for a long, long time, right?
Many, many, many years. Right.
And so this wasn't a surprise to you.
No.
Sam, for the viewer, is Sam Callender. He's a dentist, and he's been practicing biological dentistry for many, many years. No surprise to you. I'm curious, was this a surprise to you that I could get that better that fast? Be honest.
It was a surprise, but because of you, I started reading about neural therapy, so I knew it was possible. So I'm living proof. So, okay.
Thanks. You were in agony a
Yes.
few minutes ago.
Yes.
Literal agony. You were lying there
Writhing in
writhing
pain.
in
Yes.
pain.
Yes.
All right, listen, let me explain to you from my medical perspective.
Okay.
and here's a dentist standing next to me. I look in the mouth before I look anywhere else. You walk into my door with pain, I'm in your mouth.
Okay.
Not in your face, in your mouth.
Okay.
I knew the dental chart. Here's the dental chart. Empirical relationship between odontomas and organs and disease. Odontomas is teeth. And I knew that the sacroiliac is related to the third molar. So we checked your third molars one at a time, right?
Mm-hmm.
They were all removed, correct?
Right, correct.
So I had no clue what was where, right? I just knew you had 4 that were removed.
Yes,
And that one tested positive.
that's right.
Right?
I was very weak.
Very weak.
My arm just went right down.
And then, have you had trouble in that tooth? I'm curious. Or that area? Have you noticed any strange feelings in there?
I notice I have a cut in my mouth. You know, I don't know, cut in my mouth on the gums back there, but I don't have a couple molars that had wisdom teeth removed.
In other words, there's a sore there?
Yeah, because I sometimes forget I don't have teeth and I chew there and there's no molars there. Okay, so I injured my gum on the plane ride probably. And yeah, I was eating nuts and, you know, it's kind of rough.
I don't think it's just that. Now,
I don't know.
So I knew that the SI joint is related to the third molar. So that's why I wanted to check. And it doesn't mean that I would find something. We injected it.
Mm-hmm.
It's dramatically better.
Yes.
I'm going to tell you, I think you have a cavitation there.
Yes,
That's
I'm sure
my
I do.
medical opinion.
Yeah.
And I feel fairly certain of that because when I shot the area, it was pretty soft. Instead of getting into hard bone, I felt softness there that I shouldn't have felt. So you're going to get that checked out and let
Yes.
me know, right?
Yes, I'm going to the dentist.
That's very possible. Cavitation's probably what it is.
Okay.
It,
Thanks very much.
Cavitation's just an old infection.
Yeah,
That
I
you've
know. I
had
have a
to-
dentist who's going to work on it.
Yeah, that's great.
I have a dentist who's going to work on it.
And you've got a dentist. You came all the way here from Miami for our training, so it's an honor that you would come. And it's also an honor that you would allow me to evaluate you. So I
Thank
hope
you.
this works and you'll let me know. Thank
Okay.
you. Is that you just said?
Well, you just gave me the Procaine and then you followed it with the ozone, and we were talking and I noticed that my back has just gotten progressively better and I'm not writhing and I don't feel like there's pain I'm trying to not notice anymore. So I'm better. I
And
know,
you
isn't
said,
that
wow,
amazing?
I think.
Yeah, wow, truly.
And amazing.
Amazing. Yes, you are all those things. Thank you.
I don't want to be all those things. It's the therapy. It's not me. It's
Yes,
finding the healing
but you're doing
path.
it and you're teaching others. You're empowering other doctors. Okay,
Thanks.
so that is giving, and that is special.
Is there any pain left?
I don't think so. I think there's
Holy
none. I think there's
mackerel.
none. I really do. Wow.
I am glad I got you when you were writing on the
Thank
table.
you.
Thank
Thank
you
you.
very much.